Okay, it's Mari McInerney here from Croaky News, again still at the Oceania Tobacco Control Conference in Perth, and I'm talking this morning to Dr. Frank Chaloupka from the University of Illinois in Chicago.
Exactly.
Who is here to talk about the economics of tobacco control and about 4,000 other things. I think you've been the most in-demand person in town this week. With that, you said at one of the sessions that the companies have shifted their argument from health to an economic one. Can they win that one?
I don't think so. We've been doing research, other economists around the world have been doing research to show what the economic benefits are from tobacco and what the economic costs are, as well as then what the economic impact of tobacco control is. And it's really clear that tobacco imposes huge health costs, but then as a result, economic costs. So excessive spending on healthcare to treat the diseases caused by tobacco, the lost productivity that comes from people getting sick and dying younger, the contributions of tobacco to poverty. And then when we look at what the economic benefits of tobacco control are, we see that you end up with a healthier, more productive population, and that the economy does better as tobacco use goes down.
What does the tobacco industry argue in this case, and how do you counter it?
Well, they have 3 or 4 main arguments. So one argument they make is that they contribute significantly to the economy, that there are a lot of jobs that are dependent on tobacco. But what we find when you look at the actual experiences is that as tobacco use goes down, the jobs that are in the tobacco sector go down. But what actually happens is the money that people used to spend on tobacco, they spend on other goods and services. They create jobs in other parts of the economy, and what you end up seeing is actually a net gain in jobs as a result. They argue that smoke-free policies are going to be particularly bad for the hospitality sector, so restaurants and bars. But again, the same thing. We see that there are many more non-smokers than smokers, almost every country in the world. And what you end up with is that the non-smokers like the smoke-free environments, and they'll go out more often, they'll spend more, and smokers really don't change their habits as a result of smoke-free policies. So you see the bars and restaurants often do better as a result of a smoke-free policy. They talk about the impact on the poor, and the idea that tobacco taxes in particular are going to hit the poor the hardest. And there is some truth to that one, but what we see is that when taxes go up, the lowest income populations actually respond much more to those tax increases. So what you end up with is a progressive effect in the sense that the health benefits really fall on the lowest income populations. And then part of what we talk about is the idea of using some of the tax revenues to really help the lowest income smokers who want to quit in response actually succeed in doing so. And then the last one they argue about is illicit trade. So it used to be that if you raise taxes, that was going to generate a lot of illicit trade. Now that argument gets applied to things like graphic health warnings and to plain packaging. But what we see is that illicit trade really has nothing to do with tobacco control. It has much more to do with the strength of governance in countries and how effectively they control their borders, how strong their tax administration is. And we see that when countries decide they want to deal with illicit trade, if they take it on head on, they can really succeed in reducing it at the same time as they implement strong policies.
Can you say who would be good examples of that?
I think Spain is one of the better examples. So 25 years ago, Spain had some of the lowest taxes and prices in Western Europe, but they also had some of the biggest problems with illicit trade. About 1 in 5 cigarettes was illicit. And they decided to crack down on it. They strengthened their border controls. They went after the large-scale smuggling. They worked with their neighbors to really deal with the root of the problem. And what we saw was that they almost eliminated it from their market at the same time as they raised tax and price. But we've seen it happen in many other countries. We've seen it happen in Brazil and in the UK and in Canada. And so we've been doing case studies looking at what the experiences have been in different countries. And we see, again, when there's the political will to do something, then they can succeed in doing it.
Can we go back to that argument about poverty? Because that is a very difficult area, and it makes a lot of people very uncomfortable and very concerned because, yes, as you've said, a lot of people on lower incomes do give up as a result of tax increases, but a lot can't for various reasons which have been examined here. And I think you quoted the tobacco industry as saying no other tax hurts the poor more than the cigarette tax. But they have a good argument really in some ways, don't they?
No, I think that's the most valid argument of all. So we know, again, that low-income smokers will be most likely to give up smoking in response to the tax increase. But we also know that it's such an addictive behavior that there will be a lot of smokers who can't quit. And that ends up having adverse effects. They divert money away from spending on food and education and healthcare. And so it really contributes to poverty in the end. So that's why, from my perspective, the key thing is what the government does with those revenues. They really have an obligation, I think, to try to help low-income smokers quit. So providing whatever support they can for smoking cessation counseling and for some of the products that are out there that can help people quit. And then to the extent that they can redirect some of those new revenues back to other programs that target the poor, then that's going to help offset the financial impact on the smokers who continue.
You talked that can go beyond support for smokers itself. You gave an example of the Philippines.
I was just going to go there. So that's exactly. I mean, so that's in the Philippines. They went through a big tax reform a few years ago, and the new revenues, most of the new revenues that come from that, are to finance a universal health care program. So again, providing health care benefits to low-income populations that wouldn't have them. And we've seen the same thing. The U.S. did that a few years ago. Our last big tax increase was to support an expansion of our children's health insurance program for low-income kids. So again, providing those sorts of benefits that have real value will offset the financial hardships on the smokers who continue.
And yet another argument is that the incremental tax increases, excise increases that we see, for example, in Australia, that they're sort of wearing off now in terms of shock impact. And you're actually advocating bigger, less regular ones. And I think, did you say yesterday 50% or something?
Well, so the cumulative effect, right? So the Australian increase is 12.5% over each year for 4 years. One option would have been to do 50% all at once. So we've been trying to dig into that issue about whether or not the regular increases have the same cumulative effect as some bigger increase. And the research that we're doing suggests that the bigger one-time increase would actually be more effective in reducing tobacco use than phasing in and over time. So
it could be a shocker effect on people who are poor.
It would be a bigger shock, and it would be, as a result, something that would lead people to really want to change their behavior a lot more. So when they know it's coming, when it's sort of phased in like that, people make adjustments to their behavior. They can, one of the things that we've seen in Australia is that they switch down to cheaper brands. They may, and the industry partly responds to and how it passes through the taxes and some of the marketing strategies that they use. So if you really want to get the biggest impact on public health, then I think the shock value of having the one big increase and instead of phasing in over 4 years actually gets you that bigger effect. But then it brings back some of the problems that we were talking about earlier with the smokers who can't quit being most disadvantaged by that. And again, then the obligation of the government to try to do what they can with those revenues to offset that.
In terms of lower income countries too, we've got quite a few represented here, and it is the Oceania Conference. What's your sense of what big issues that those countries are facing, particularly around tax or the economics of tobacco control, but also with the growing influence of more concentrated tobacco companies, etc.?
So I think the one thing that we've seen around the world is that high-income countries have done a really good job of dealing with tobacco, and tobacco use is falling in almost every high-income country in the world. But we're not seeing the same thing in low- and middle-income countries. So there still are countries where tobacco use is on the rise, and I think that's particularly true for low-income countries. And I think there's a couple of things that are going on. One is that governments in those countries have not adopted strong tobacco control policies. And I think in part because they hear the arguments that the industry makes about all the bad things that are going to happen, and they're put off by some of that. And then the other thing is, the companies have gotten much bigger. They've gotten much more concentrated. The world's tobacco markets are really dominated by a handful of companies at this point. And they take advantage of international trade agreements and investment agreements to do what they can to challenge national tobacco control policies. And that's happening everywhere. So Australia is in the middle of a couple of fights over plain packaging, one in the World Trade Organization under the trade treaties, and another one in an investment forum under a bilateral investment treaty. But Australia has the resources to fight those sort of fights. Many of the low-income countries are particularly deterred because they don't have the same resources to go out and do that.
So how do big countries support that?
So the big countries can take the lead like Australia is doing and set the precedent that these are effective policies that will stand up under these international agreements. And then the other thing that's happening is that some of the big philanthropists in the world have decided that they're going to create a fund to help low-income countries defend their tobacco control policies against these challenges. So Michael Bloomberg in New York and Bill Gates have gotten together and created this global fund to help support countries that are facing these sorts of challenges and that don't have the resources to fight.
And just one more question, because I know you're conducting a workshop this morning, any minute now. E-cigarettes, it's a very contentious area in Australia, not so in the United States, although perhaps
very contentious in the United States.
But much more prevalent.
Much more available, yeah.
You suggested yesterday that perhaps Australia should look at a more open market, but a very highly regulated one.
Exactly. So in the U.S., we have seen e-cigarettes come in and be virtually unregulated at this point, and the policymakers are trying to catch up. So there's been a little bit of progress, but not much. So what we see in the U.S. is a lot of kids using e-cigarettes, which is a big cause for concern. So kids are more likely to smoke e-cigarettes or to vape e-cigarettes than they are to smoke regular cigarettes. And that's a consequence of the fact that there haven't been many restrictions in the past on how old you had to be to buy them. There's no restrictions on marketing at this point. They're not being taxed almost anywhere. So they're widely available, aggressively marketed. Kids are starting to take them up. So that's a problem. And you wouldn't want to do that in Australia. You'd want to bring them in a way that would keep the markets tightly regulated the same way that tobacco products are. So the same sort of restrictions on marketing, cover them under the smoke-free policies so you can't vape in places that you can't smoke, make sure the kids don't have access to them. And I think you can get then some of the benefits that come from e-cigarettes. So I think there's a lot of debates over just how much less risky they are than conventional cigarettes. But I don't think there's any doubt that they're less harmful than combusted tobacco products. It's the burning of tobacco that causes a lot of the problems. So if they were brought in a way that was regulated and kept them out of the hands of kids, but at the same time made available to smokers who have a hard time quitting, I think we could see real public health benefits from that if we could get smokers to switch entirely from combusted cigarettes over to e-cigarettes. So I have ideas on how you do that with tax policy and having a high tax on cigarettes and a tax that's enough to discourage kids from taking them up, but not so high as to discourage the substitution with cigarettes. But it's definitely a controversial issue.
Absolutely. I suspect we can talk about that at the next conference. Yeah.
We'll have a lot more evidence on how these things play out because different countries are taking very different approaches. So by the next conference, we'll know more.
Good. Thank you very much, Frank. I really appreciate it.
Thank you.